Hello future parents, in this video we go back to talk about postpartum, in particular with the postpartum recovery after a Caesarean birth. Let's start! Hello everybody and welcome back to my channel. If it is the first time you drop in this channel, my name is Ilenia and I'm a midwife with a passion for education and empowerment during your pregnancy, birth and postpartum journey. I've been a midwife for more than 6 years now and I currently live and work in the United Kingdom. This video is linked to a previous videos that I've done all dedicated to the Caesarean birth, where we went through what happens before a Caesarean birth and during a Caesarean birth. In this video we go through what happens in the first hours or days after your Caesarean, and I'm gonna give you some tips in order to have a smoother and healthier and happier recovery. So what happens after your Caesarean birth? You're gonna be wheeled to the recovery room when you're gonna spend your usual 2-4 hours to make sure that you're not bleeding, that your vitals are fine. In this time, you're gonna try to do as much skin to skin as possible with your baby, and to start breastfeeding is what you wanna do. If you have had a epidural or spinal anesthesia, then you're not gonna feel a huge amount of pain at this point because the anesthesia kind of lingers up to 4-6 hours even. If you had a general anesthesia instead, you're gonna feel a little bit rubbish at the beginning and the pain is gonna come a little bit sooner. So it's very important that you get pain relief, that you say to your midwife that you're in pain, because the sensation is gonna be there a little bit sooner. But usually morphine is given through your IV access just straight after surgery, so don't worry, not because you had a general anesthetic you're gonna be more in pain. It just needs to be managed a little bit differently. So my first number one tip that I want to give you is try to stand up as soon as you can. So I was saying before, if you have a spinal, usually after 6 hours you can easily stand up. Easily, it's maybe an optimistic word. You can stand up or just even sit at the side of the bed with the help of a midwife or whoever is there to support your first mobilization after the Caesarean birth. And maybe the catheter, the urinary catheter, is going to be left in place for a few more hours. This is because the bladder usually takes a little bit longer to get back to its normal routine after the anesthesia. But although you're going to have the urinary catheter, you can still stand up and try a few steps. This is going to really help your recovery, to speed up your recovery. Same story if you have a general anesthesia, you can try to stand up if you don't feel too drowsy as soon as you feel, really. Also, you're gonna be given some anti-clotting blood thinner injections. You're gonna have some compression stockings as well, that together with the anti-clotting and the early mobilization is gonna really improve and reduce the risk of blood clots, that you're gonna be more exposed after birth in general, but especially after Caesarean birth. Another advice that I wanna give you is that please take the pain relief that we offer to you. Some mamas I find are a bit resistant. They're like, I'm fine, I don't feel pain, and then the pain ramps up suddenly from nowhere and it's very hard to get it back to a normal, bearable level. So you're gonna have usually 2 types of pain relief, meaning some paracetamol and some anti-inflammatory, some NZ. If this is not enough, you're gonna have also some opioids like codeine or morphine in the worst case to control your pain. So please make sure that you take what you are offered in the first 48 hours, which usually is the time that you're going to be in the hospital. Sometimes you can go home even sooner than 48 hours, but usually in the first 2-3 days, please make sure that you are on time, that you take them every 4, 6, 8 hours whenever they are due. Another thing that you have to do is try to avoid constipation. So by drinking a lot of water, trying to eat food rich of fibers, and also take some stool softeners. They're gonna be offered to you because the first poo can be a little bit mentally hard. So it's very important that when you sit in the toilet, you don't strain, so that you don't have the feeling that your wound is gonna rip apart again. You can also use a stool to elevate your feet, and please try to go as soon as you feel you have to go. Don't keep your poop inside because you're afraid of actually going to the toilet. It's very important that you avoid constipation. Since we're talking about toilet, I'm also gonna mention that the first time you go wee, it might sting, especially because you're gonna have the catheter removed, so it's normal that the first time or two are a little bit stingy. Don't worry, make sure that you are nice and relaxed on the toilet, and then you have maybe a jug of water to pour or a sport bottle where you can squirt some water around the area after the urine or during the urine. That is gonna help you reduce the sensation of stinginess that you might experience. These tips are for either if you had an elective section, meaning a section that was booked, or if you had an urgent section during labor. What I want to differentiate is that if you had an emergency section, please do ask for a debrief. I'm sure if it is a good place where you're going to give birth, they're going to give you a debrief anyway, if you ask it or not. But please, if no one came to you after the birth to explain you what happened and why it happened, please make sure that you ask so. Because if the decision was taken during your labor quickly, and maybe they just mentioned to you very briefly why they had to bring you to the operating theater, then you need to really metabolize what happened to you, and you can do so a few days after birth. So some places offer like a 6 weeks debrief, or usually like a general quick debrief is done while you're still in the hospital to make sure that your questions are answered and that you are able to really digest and to process a birth that maybe was not what you were hoping for, and that you don't have any regrets or any blame to give on you, and you can easily avoid that by having your questions answered. So make sure that you ask for a debrief. So those were all tips to use during the first days, but the same apply when you go home. The things that I want to ask that you should avoid to do when you go home, for example, is to lift heavy things that are heavier than your baby, so above 5 kilos, 10, 11 pounds. Try to have someone to help you with that. Try to have someone that brings you the baby. Try to limit the movement, the heavy lifting that you do. Obviously, you have to do the bare minimum, especially if you have other children at home waiting for you, but try not to exaggerate with the lifting. The dressing, usually you're gonna go home with the dressing, and it's gonna be removed by the midwife when she comes home to do your first visit. Usually is day 3, day 5. Usually it's a waterproof dressing, so you can go in the shower, you can use the body soap for your body, and then just use some water running through the dressing. It's alright. The stitches are dissolvable, so they're gonna go away. You don't need to go back to the hospital to have them removed unless you have clips placed, but in that case they're gonna tell you to come back, or the midwife is gonna come to your house to have them removed, usually at day 7 or day 10. Otherwise, you don't have to do anything to your wound, just keep it dry and clean. Try to hold your wound when you cough or sneeze. That is a good tip that is gonna help you to feel less pain. Gently support your wound. You can do so when you are on the toilet as well. And then also please bear in mind that you're gonna bleed. Even if you had a cesarean birth, you're gonna have blood coming through the cervix and the vagina, so you're gonna need some big pads for the first days. Usually the bleeding after cesarean birth goes away a bit quicker than from a vaginal birth, so you can expect the bleeding to go away a bit sooner, but you're still gonna bleed a little bit after cesarean birth. If at any point during your recovery, when you're at home, you experience a sudden increase of your bleeding, you see clots, then go back to the hospital. Other alarming symptoms that you might experience that require you to seek medical attention are redness around the wound area, maybe oozing, like purulent, smelly oozing, or that you suddenly have fever, that you feel unwell, that you have a headache. Those are all symptoms that require medical attention, so please make sure to give a call to your midwife or doctor and or go to the hospital. That's all for this video. I hope that it was helpful in order for you to have a smoother and better recovery. If you've not done so already, please subscribe to the channel and like the video. I'll see you next time. Bye bye.